Happy Wednesday, everyone, and welcome to this month's edition of the Circle webinar, Mindfulness May webinar series. We want to acknowledge that we are hosting today's session from the traditional territories of the Coast Salish, Musqueam, Squamish, and Tsleil-Waututh nations, and the Anishinaabe, including the Mississaugas of the Credit, Haudenosaunee, and Huron-Wendat Wyandot territory. And we are honored to have team members and attendees joining from other territories across North America. My name is Davin Gislason. I am the Manager of Talent Acquisition at Thrive Health. Please note that this session is being recorded and live streamed on LinkedIn, and the recording will be available online afterwards. Also, we do have a Q&A section, so if you have any questions throughout the webinar, please feel free to enter them, and we will be saving time near the end to go through those. Without further ado, I'm excited to introduce our speaker, Yeung Liu, MA Registered Psychotherapist qualifying. Yeung, is a therapist who works with clients to help them understand themselves and their unique experiences. He has 9 years of experience as an international recruiter and has developed an understanding of the challenging balance of a demanding and competitive work life with a meaningful personal life. His approach is integrative and adaptive to the needs of the client, drawing from cognitive behavior therapy, acceptance and commitment therapy, mindfulness-based approaches, and dialectical behavior therapy. He also integrates narrative, trauma-informed, and Eastern perspectives on mental health into his practice. Outside of work, he enjoys cast drawing and drawing manga in pencil and ink. Yeung, I'll pass it over to you.
Thank you, Davin. Okay, welcome everyone. My name is Yeung, and I'm a psychotherapist at Integra Health Center. And today I'm just very excited and happy to talk to all of you about mindfulness and meditation. Next slide, please. So our presentation today will be kind of like a mindfulness and meditation 101 course, where we'll first have a brief history lesson about both mindfulness as well as meditation, covering some of the integral relationships and concepts that bind these two concepts together. We'll also go through some of the latest research about mindfulness and meditation, about how both practices benefit our mental health, our body, and may even help us to become better leaders and managers in corporate settings. Also, we're going to teach not one, but two different meditation techniques today. And so before we start, engaging our minds and, dig into the details, I'd like for all of us to just make a quick mental note about our current energy levels and our ability to concentrate, okay? So maybe some of us have had a bit of a lunch already, and that's kind of directing blood flow away from our brains. Maybe some of us, like myself, have quite a bit of caffeine in our system and are kind of hyped up and jumping around a little bit. Both are fine, both are great. And so let's just quickly notice how present we are, make a quick mental note, and we'll revisit how we feel as we delve more into practicing meditation. Next slide, please. So first things first, let's get our definitions in order by asking, just what mindfulness is. So mindfulness is academically defined as the basic human ability to be present, aware of ourselves, while also, kind of staying cool and not being overly reactive or overwhelmed by what's going on, both inside as well as outside of us. So this could be a confusing concept to kind of wrap our heads around, but it's probably fair to say that everyone has experienced some moments of mindfulness in our everyday lives where we're just absorbed in the present, not really thinking, and just experiencing what life or the universe, let's just say, is giving us. So think back to the last time you've watched a beautiful sunset, or when you've spent some quality time with someone you care deeply about, or being on holiday and finally laying out that big sigh, sitting on a beautiful beach and just looking towards a beautiful stretch of ocean. That's essentially mindfulness. And on top of that, mindfulness is also a structured way or method to train our ability to access and multiply these moments in our life. Next slide, please. So The concept of mindfulness as we know it is actually a Western concept that's really only existed for about 50 years, give or take a decade. And with that topic in mind, we'll first bring up a gentleman by the name of Jon Kabat-Zinn. He quote unquote discovered the Buddhist philosophies that turned into mindfulness through talking to various Zen Buddhist missionaries who were touring America at the time that he was in college. And he also furthered his studies with two Zen masters, Thich Nhat Hanh and Song Sang, respectively. So after a few more years of scientific research and studying, no doubt quite difficult in the 80s, Jon Kabat-Zinn then started a program called MBSR, or the Mindfulness-Based Stress Reduction Program, which to this day is still the most well-studied, evidence-based mindfulness group therapy program that's effective at treating depression, chronic stress, and other challenges with mental health. And one of the key reasons behind its widespread adoption has to do with the way the program is designed to be as secular and scientific as possible. And now, perhaps directly because Kabat-Zinn took a scientific and secular approach, mindfulness is everywhere, and it's pervasive in the academic world, in the commercialization of yoga, meditation apps, mindfulness therapy, corporate training, you name it, which is all amazing. And at the same time, the widespread use of mindfulness is somewhat achieved at the cost of some loss of nuance. Some loss of culture, some loss of philosophy from the Eastern traditions that it originated from. Next slide, please. And so, speaking of nuances, particularly in meditation, the earliest written records of meditation are in the Vedas, which are also the oldest, holy scriptures in Hinduism, as well as other karmic religions that followed, including Buddhism. And the first of the Vedas was written around 1500 BC, or around 3,500 years ago. Of course, we also have to bear in mind that religious traditions and practices generally in the Indian subcontinent were passed down orally from generation to generation before it was passed down in a written form. And so a more accurate indication of just how old the meditative tradition is are things like cave paintings. And paintings of people, kind of sitting in meditation postures have been traced back to anywhere between 5,000 to 3,500 BC. And so we actually have pretty good evidence to suggest that us human beings have been meditating for anywhere between 5,500 to around 7,000 years. And so in other words, it's actually quite fair to say that, human civilization developed side by side with meditative practices. And while the Western scientific method is, incredibly powerful, responsible for much of the innovations that directly produce our high quality of life, responsible for this presentation today, sometimes the Western method results in us throwing the baby out with the bathwater. The culture, the underlying philosophies about life, karma, the universe, existence, the spiritual concepts relevant to meditation, the discovery that meditation should actually fit a specific person's temperament and needs, all of that grew organically with generations and generations of people meditating and learning from each other, talking to each other. And I found it incredibly helpful for my clients' mental health to take the time to include and reference these relevant concepts in my psychotherapy practice. Next slide, please. And so one way in which we can understand meditation is that it is traditionally understood with two different Sanskrit words. The Sanskrit word dharana is the action part of meditation, roughly translated to be the collection or concentration of the mind. And so in this particular, angle of interpretation, let's just say, meditation is something that you do, a technique, a way in which we achieve concentration or one-pointedness of the mind. Then there's the Sanskrit word, dhyan, that indicates a state of no mind that we can sometimes arrive at during meditation, where we're conscious and just, kind of existing without any thought or emotion. Our sense of self or ego also tends to melt away for the moment, and we're almost left with a sense of peace. Usually when a more experienced meditator says that they've, had a great meditation session, what they're actually referring to is how they have ended up in the state of dhyan and stayed there for a while. And so I just want to be really careful with the wording here, and I want to just emphasize again the sentence of how they have ended up in the state of Dhyana. So what this actually means is that no one can actually choose to go into the state of Dhyana or the state of no mind. Doesn't matter if it's the Buddha or any of the enlightened yogis. It's just a state that kind of happens to us when we're performing a specific technique or dharana, and especially the types of dharana that fits us. And so when we meditate, and you may find that you didn't arrive at the state of no mind, that's actually completely okay and normal, because no one can actually choose when those moments arrive. All we can do is to meditate and then experience what occurs. And so with that said, let's meditate. So the first meditation technique is going to be something called alternate nostril breathing. I generally teach that a lot as a first technique, particularly for my anxious clients who have a relatively busy mind. And for this particular meditation, depending on your main hand, I'm right-handed, so I'm going to use my right hand. If you're left-handed, that's also completely fine. But you may have to reverse the directional instructions that I'm about to give you. Okay. And one more note about breathing and meditation in general, and especially alternate nostril breathing. For those of us who have a deviated septum, unfortunately, this meditation is not going to work as well for you. And I apologize in advance, and I hope to make it up to you by teaching you another technique towards the end of this presentation. But having said that, we take our dominant hand, right or left, and the fingers we will be using are our thumb and our ring finger. Okay. And what we do is we block our right nostril with our thumb, and we gently breathe in from the left. Hold that breath. Don't breathe out yet. We switch. Now ring finger blocks the left nostril, and we breathe out of the right. We breathe in again from the right. Switch. Breathe out. Breathe in. I'm going to close my eyes now, and I suggest you do the same. Switch. Breathe out of the right. Breathe in from the right nostril again. Switch. Breathe out. In. Switch. Out. In. Switch. Out. Now continue at your own pace and just find your own pace of in, switch, out. Noticing how it might be easier to breathe through one of our nostrils compared to the other. Notice how all of this feels like. To breathe in this way that we're not used to breathing in. And as you're focusing your attention on your breath, sometimes what happens is that our mind offers us some ideas, some words, some images. And that's completely normal, and that's completely okay. And when we notice these thoughts, let's acknowledge that they exist. Spend 1 or 2 seconds within your mind just to kind of tell yourself what kind of thought it is. without engaging with thought. And once we've just gently acknowledged the thought, we want to gently bring our attention away from our mind and back to the nose, and back to our in, switch, out. Each time we notice, acknowledge our thoughts, and move our attention away from them, that is one mental push-up. And as we move towards the end of this practice, I'd like you to notice how your breath may have changed, if at all, during this time. Maybe it's just a little bit deeper. Maybe it's just a little bit slower. Maybe it's more your pace. When we're ready, we can finish the round that we're on, and then once we've done that, we can put down our hand with our eyes still closed. When you're ready, I would like you to take one deep breath in with both of your nostrils. Just notice how that feels like. When you're ready, you can take one more deep breath in. And on the breath out, slowly open your eyes. And now we're back to reality. And I would just like to, ask all of you openly, how did it feel during the meditation and how does it feel after the meditation? Particularly given our comparison with the mental moment that we conjured for ourselves in the beginning of this presentation when I asked you, what are your energy levels at and what are your concentration levels at? I feel like I'm singling Davin out, but I would very much like to ask Davin about his experiences.
So at the beginning, when you had asked, to take note of where we might be, I was, a little energetic, a little pumped because, this, public speaking and it makes me nervous. But now I feel very calm. Like I'm just very, very relaxed and, yeah, feel great.
Yeah, absolutely. Thank you very much for your answer, Davin. I've heard similar things with my clients, and they have almost described that this meditation tends to balance out their energy. And so when we feel super tired, when we do this meditation, generally we will feel more energetic. And when we feel super pumped up, with some caffeine in our system, some, anxiety, public speaking, etc., what it does is it tends to calm us down. And so this may be part of the reason why I find it so helpful to start people off with this sort of meditation techniques first before we, build up the specificities of it, etc. Okay. With that out of the way, let's continue our presentation and our relatively deep dive into meditation and mindfulness. Next slide, please. So I hope to use the remaining time to share with you some scientific research about both meditation and mindfulness, especially for those of us who are just relatively more skeptical, logical, and just looking for more data about how meditation and mindfulness can help us. So to start off, we have pretty high quality evidence over the past 15 to 20 years that meditation literally changes our brain structure. And it doesn't seem like it takes long for those structural changes to happen either. Around about 40 days of deliberate and consistent practice is required before scientists can measure changes in things like gray matter volume, which is linked to learning, memory, emotional regulation, and empathy, as well as increased cortical thickness and detectable resilience against depression. There's also good evidence that long-term meditation helps with protecting the brain against, annual tissue loss. And that might be exactly be, why we often see a lot of older monks and spiritual people who can maintain their presence, empathy, as well as cognitive speed compared to other people their age. Next slide, please. We also have pretty good evidence that mindfulness benefits the body. So for example, a 2019 review found that mindfulness was effective for cancer patients in reducing stress, pain, and fatigue, and also improves their sleep quality, immune response, and overall quality of life. Mindfulness practices are also associated with higher levels of anti-cancer hormone production in our body. And there's also evidence to suggest that 2 months of mindfulness practice boosts our immune system, making us more resilient to infections. There's also pretty good evidence that mindfulness gives health a boost in general across multiple dimensions with sleep and immunity. And mindful eating in particular could also be able to change our relationship with food, helping people to manage their weight better through the act of, really focusing on our eating and learning to savor our food and by extension, our experiences, instead of just reactively and sometimes, compulsively giving ourselves food and other experiences. Next slide, please. So we also know that mindfulness has direct benefits for mental health. Lots of research on general mindfulness as well as MBSR indicate that both are effective against anxiety and depression. So for example, we know as early as 2010 that mindfulness can be as good as, if not better, than antidepressants in the treatment of and the relapse prevention of depression. There's also some evidence that mindfulness by itself is beneficial for anxiety and depression, even without psychotherapy. Although I would also add that in my experience as a psychotherapist, doing both tend to yield the best results. There's also research demonstrating that mindfulness is helpful at increasing well-being, job satisfaction, and reduces perceived stress with the meditator. And finally, there's also some pretty good evidence to indicate that mindfulness helps with our brain's executive functions, including memory, better recall, better management of distractions, and better decision-making. Next slide, please. So here's a big one. Mindfulness is also found to be related to quote unquote authentic leadership, which is defined to consist of a high level of self-awareness, where the leader is clear about their strengths and shortcomings. Mindfulness is also related to relational transparency, where the leader is also, open to honestly showing their emotions and who they really are. It's also related to open and unbiased processing, where the leader is open to take the followers' perspectives into account, as well as strong moral values and congruency of actions. Or in other words, mindful leaders tend to do what they say, and they have a moral system that they reference and act out consistently. And so what was found was that, mindfulness practices actually makes leaders more authentic. And that's something that both the leaders themselves and their followers rated. When it comes to the mechanisms of how these changes come about, the scholars have noted that rather than focusing on a specific leadership style or way to communicate like traditional methods, mindfulness interventions instead train a specific quality of mind or way of being. This entails a more holistic approach that enables individuals to discover, support, and act in congruence with their true self. The thing about traditional leadership training is that, at least in my personal experiences, a lot of it is skill set focus. Things like, goal setting, right? How to intellectually stimulate your followers, etc. But I think one shortcoming is that many of these techniques tend to be rather shallow. And when the techniques aren't, actually compatible with the leader's own personality, what the training can do is actually further erode or degrade the relationship between the followers and the leaders, as they, at the very least on the surface, appear more fake or inauthentic, which is the opposite of what mindfulness does. The study also suggests that mindfulness may be the way forward for those of us who want to be leaders, but don't feel that they naturally fit into a leadership role. And so I hope these areas of research serve to illustrate to us just how flexible and holistic the practice of mindfulness and meditation can be towards benefiting our mental health, physical health, and even our careers. Next slide, please. So before we move on to the next meditation practice, I'd like to just outline one more key difference between mindfulness and meditation practices, right? So meditation and mindfulness techniques, generally speaking, fall into two general types. The first type is called open monitoring techniques, and the second type is called focused attention techniques. So both types of meditation have been studied to some extent, and open monitoring meditations essentially make up most of the mindfulness repertoire of meditation techniques. Open monitoring is associated with divergent thinking, basically, starting from one point and, extending your thinking to multiple different points, which some people would actually consider to be creativity. Unfortunately, open monitoring techniques and trauma are generally not a very good combination, because open monitoring techniques tend to turn our mind into some sort of a vacuum. And because of that, some of our traumas may actually rise up to fill the vacuum and overwhelm and even re-traumatize us. And so this is why for programs like MBSR or MBCT, which is mindfulness-based cognitive therapy, gentle reminder that we're still talking about mindfulness here, and most mindfulness techniques are actually open monitoring techniques. Because of this, there's actually often an intake process where the clients with significant trauma are discouraged from or even forbidden from attending MBCT or MBSR sessions. And so the other group of techniques is called focus attention meditation techniques. And what we did earlier, the alternate nostril breathing, is one of the focus attention meditation techniques. And so what focus attention techniques generally do is that it tends to improve convergent thinking, which is kind of the opposite of divergent thinking, where you start off with multiple points of data, and then we end up with a quote unquote correct answer, right? It's also been found to strengthen our ability to self-regulate, overcome problems, and detect errors in our thinking. Focus attention techniques also tends to ground people, gives them stability, makes them feel a lot calmer. And I found that, particularly for our generation of busy lives and busy minds, and especially for my anxious clients, I just find that, focus attention techniques plainly works a lot better most of the time than open monitoring techniques. And so without further ado, let's wrap up our talk today with another focused attention meditation technique, which is called triphasic breathing. Okay, so this is somewhat complicated, but I will try to demonstrate this either way. So for now, I'm just going to zoom in on my upper body, and the way to perform this technique is, first of all, if you can, breathe into your stomach, and just the stomach. Okay, so I can lower my screen a little bit, and what you can see here is that I'm placing my hand on my stomach, on my abdomen, and what I will try to do is to kind of push out my belly button as I breathe. Okay, and then as we breathe out, we make it so that the belly button is closer to our spine. So let's just practice that for a while. Okay, belly breathing. I know that we're educated to think that the correct breathing is through our chest, but if we observe the breath of babies, for example, we will find that abdominal breathing is actually the default. Okay. So the first phase is to breathe in and out of our stomach. Okay. Now for the second phase, what we do is we breathe into our stomach, we breathe into our chest, same breath, and then we breathe out. third and final phase. Okay. We breathe into the stomach. Now you can close your eyes. Breathe into the chest, same breath. And now lift your shoulders up just a little bit and then breathe that extra 10% of air. And then breathe it all out. When you're ready, you can sit up straight, shoulders back, head, neck, back in alignment. And just start with the triphasic breathing. First phase, stomach. Same breath, chest. Shoulders lift up, extra 10%. Breathe out. As usual, find your own pace. Stomach, chest, shoulders. Breathe out. If you feel ambitious, if you feel like a tryhard, what you can do is you can breathe into your stomach, breathe into the chest, lift up the shoulders, breathe into it as well. And then breathe out of your shoulders, breathe out of your chest, and then breathe out of your stomach. Once again, our thoughts may emerge. And when they do, we notice them, we acknowledge them, and then we move our attention gently back to the practice. And on top of that, as we're doing this meditation, let's focus on our core. Sometimes we may feel specific sensations, maybe in the stomach, maybe in the chest. When we do detect those physical sensations or emotions, what we do is we notice it, we quickly label it for ourselves, and we gently move our attention back to the practice. Let's aim for 3 more rounds. After you finish your last round, just breathe normally. Oh, how we may have missed that sensation. When you're ready, you can slowly open your eyes. And I hope all of you have enjoyed this brief talk and appreciated some sense of peace in our process. Thank you very much.
Thank you for that. I feel calm. I feel so calm and chilled right now. We did get some questions that came in. I'm gonna start asking you some. Yeah, sound like a plan? Okay. So one of the questions is, I'm curious why the nostril breathing can feel unbalanced or easier on one side versus the other. Does it align with your dominant side? I'm right-handed and my right nostril was easier to breathe through. Oh, I believe we've lost Johan. Hold on one moment. Just gonna see if I can get someone to help me out here. Oh, we have there.
Sorry, everyone.
Cool.
Slight mishap. Click the wrong button.
Welcome back.
Thank you.
Yeah, I was. I don't know how much of the question you caught, so I'm gonna go through it from the beginning again. I'm curious why the nostril breathing can feel unbalanced, easier on one side versus the other. Does it align with your dominant side? I'm right-handed, and my right nostril was easier to breathe through.
Yeah. So before I answer this question, I would give a caveat to say that the study of mindfulness is a relatively young field, and generally academics move a lot slower than what we would like it to be. And so we have some preliminary evidence that our nostrils, our different nostrils, are actually mapped towards different nervous systems. Particularly, one nostril is mapped more towards the sympathetic nervous system, and while the other nostril is mapped more towards the parasympathetic nervous system. So not to get too deeply into neuroscience here, but one of those systems generally tends to hype us up, and the other generally tends to calm us down. And so I think what happens in alternate nostril breathing is that we are equalizing our interaction with both of these systems, thereby balancing out our energies.
Fascinating. That's really neat. Another question. There are evidently many types of meditation techniques and programs. How does one determine the best type of meditation they need to reduce stress or pain or depression? Is there a list or reference people can read to look for?
That is a very good question, and I don't know about the quality of my following answer. So as we talked about, mindfulness is a concept that has been studied for about 40 to 50 years. And so there is actually a slight leaning towards addressing depression when it comes to mindfulness techniques. Unfortunately, as we also went through previously, trauma and mindfulness, generally speaking, are not a very good mix. Because what mindfulness does is it tends to leave our mind blank so that the usual defense mechanisms that we have to suppress the trauma and to live normally no longer functions. And so, especially given that, a lot of depressed people are actually pretty traumatized people. This is part of the reason why I generally tend to stay away from mindfulness practices, except if my clients present with depressive tendencies, particularly in terms of lack of motivation, in terms of an inability to carry through with their actions. What I'm seeing with at least my current client list is a lot more anxious minds, busy minds, minds that need to be engaged. And in my experience, focus, attention, meditation techniques like alternate nostril breathing, triphasic breathing, Om chanting, the more traditional techniques tend to serve these people a lot better because it gives them another source of focus to bring their attention away from their mind. And so I also come from an education background where meditation should be customized for the individual instead of something that is following a template or following some sort of instructional course. How I usually approach meditation with my clients is that I tend to teach them a bunch of different techniques, mainly from the more traditional sources. And generally speaking, what happens is that each client tends to gravitate towards their own specific technique that they find easy and they find calming. that's going to be different for everyone. And unfortunately, I don't think there is any academic or mind-focused, idea-focused way to discover that. I think ultimately the right meditation technique needs to have a fit with the person in mind. And so my advice is to just try a bunch of different meditation techniques as well as mindfulness techniques, and then consult your experiences and try to find for yourself what is the best technique for you.
Thank you. I know sometimes I've like spoken with friends and or colleagues, and on the topic of mindfulness and meditation, and sometimes they'll mention, "Oh, I do this. It works for me so great," and I tried that, and it just did not have the same effect. It's just not for me. I don't think that one's for me. But
yeah, often when I talk meditation with my clients, the overwhelming response that I get from them is that it is boring.
So not the
And so,
one
yeah,
for them.
yeah. And if you find meditation boring, sorry, if you find mindfulness boring, try meditation.
Okay. This is a good one. Will meditation really help my health, intelligence, and creativity? And how do I make meditation a habit?
Okay. So these are that actually sounds like 3 to 4 different questions to me. So I will try to answer each in turn. Okay. So will meditation guarantee results? I would say it depends on the individual. It depends on the person's unique cognitive fingerprint. I think some people just have an easier time getting to the state of no mind than compared to other people. I think that, generally speaking, if we choose the correct meditation technique, or quote unquote correct meditation technique for the right person, and that starts a self-motivating cycle in which they just start practicing diligently, and they can report consistent calming effects as well as getting into the state of no mind, then I think meditation has a very good chance of improving their health, their mental health, as well as their relationship with the world at large. Sorry, Davin, what's the second
The
question?
second part was, and how do I make meditation a habit?
That's a very good question. So I find myself trying to resist giving some sort of generic framework of get a schedule in order, and then figure out the best time for you to meditate, and then just do it, right? My own experiences with meditation has taught me that it is a natural process, and the more we try to plan for it, the more we try to force ourselves into it, the more we make ourselves vulnerable to thoughts and emotions during the meditation practice. And so I will just give the advice that I give to my clients. Try a bunch of different meditation techniques, see which ones you enjoy and see which ones you gravitate towards, and then just remind yourself from time to time to just do it, and then see what happens.
Another question, how can mindfulness be incorporated into corporate culture?
That's also a good question, and I have, in my research, I have seen different ways in which mindfulness is integrated into corporate culture. And overwhelmingly, I see a lot of mindfulness meditation sessions with the entire team kind of sitting together, and then kind of meditating with everyone else, with each other. And I think there is something to be said about the communal feelings, sensations, and experiences that we get with meditating with other people. I think it's powerful. I think there is a reason why in a lot of Eastern traditions, meditation is actually a group activity instead of a solo activity. I think it does foster increased well-being and teamwork, as well as almost an increased amount of trust with the people that you're meditating with. I have not seen many mindfulness programs that are kind of directly targeted towards certain individuals like managers and leaders, although I think maybe there should be such programs to essentially work with leaders and to help them to narrow down their experiences of being a leader, integrate mindfulness, integrate meditation, and once the leaders and the managers' understanding of themselves, other people, as well as their own behaviors, let's just say, then there could also be some follow-up sessions in which these sorts of methodologies, as well as approach towards management, can be discussed in more detail now that everyone else are more clear as to how they conduct life, how they interact with their staff. I hope that answers your question.
Yeah, and another one just came in that I think is very similar to this, or follow up to this, is: have you seen organizations that provide meditative services to their employees several times a week or month? That was one, and then part two, if it's not too much, can it be effective virtually as on-site, and are you aware of companies or entities that provide it as a service?
Okay. So first question is, am I aware of companies offering multiple meditation or mindfulness sessions
several times a week or a month? Yeah.
I am personally not aware of companies who do that. I understand that it could be a tough sell to upper management to justify lost productivity and sitting like 50 or 60 people in a room not doing any work, but then apparently that increases productivity. I get that. At the same time, I think meditation sessions, multiple meditation sessions per week with other people may be slightly excessive. Although I would be very interested in any sort of scientific research or data regarding its effectiveness. Sorry, what's the second question again? I just keep forgetting.
Can it be effective virtually as well as on site?
I will just reference my own experiences with being a therapist, both on-site, face-to-face, as well as virtual. I found that meditation has been helpful for both my virtual as well as face-to-face clients. I also find that in the face-to-face settings, when I'm doing the meditation with my clients, and there's more body language involved, there's more intuitive communication involved, let's just say intuitive exchange of information, I tend to find that those clients tend to improve slightly quicker than the virtual clients that I meditate with.
This one's an interesting one, and one that I've wondered myself often. How is meditation different from daydreaming, contemplation, self-hypnosis, or just resting your eyes?
Okay, daydreaming, contemplation, self-hypnosis, or just resting your eyes. Okay, that's a very good question. And I will split it up into 4 questions as well. Okay, so when it comes to daydreaming, how we define daydreaming is incredibly important. So here's my definition of daydreaming. Okay, daydreaming is mental activity without consciousness. And so what that means is, like dreams, we are an audience to the mental activity and the drama that's happening in our heads. But the control of consciousness and awareness is not with us. We are carried away by daydream. When we daydream, time tends to disappear, and our attention wanders from one daydream to the next, to the next, to the next. And so in this particular way, meditation is actually the complete opposite of daydreaming. Because meditation is a state where we essentially are aiming for no mental activity and full consciousness and full awareness. And so dreaming and daydreaming are actually the exact opposite of meditation. Okay, so second question, contemplation. My definition of contemplation is deliberately thinking about specific topics. And maybe there's also an implication of generating insights or new patterns of thought from it. Okay, and I think as we experienced just now, meditation is actually not about thinking or contemplation at all. It's the opposite. I think what meditation genuinely is, in a nutshell, is the practice of creating time away from our mind. And because the mind is essentially the source of our suffering, mindfulness and meditation tends to help with all sorts of mental illnesses as well as physical issues. Okay, so I think the term self-hypnosis is a little bit similar to contemplation in the sense that it's a process associated with thought. And with self-hypnosis, it actually sounds a little bit more like we are trying very hard to convince ourselves of ideas that we know deep down is not true. Kind of like self-deceit. But then again, with the term self-hypnosis, I suppose different people may have different interpretations and usages of the term. Okay. And I think with our experiences in meditation just now, I think there's also ample evidence to suggest that is not just resting your eyes, because it's very directed. Just resting our eyes, once again, implies a lack of control over where our attention is directed towards.
That was a loaded question. That was that was a lot more than what I thought. Thank you.
Yeah.
I'm going to move to what I think is a simple question because I know we're getting close to 10 or to 10 Pacific time. How can I make sure I do not get distracted when I am meditating?
Let me think about this. Because it sounds simple, but it's actually not.
Yeah.
Okay. So I think the reason why this question is tricky is that it fundamentally assumes that distractions during meditation is a bad thing. I think that is actually not the case. I think particularly with focused attention meditation, particularly with what we talked about in terms of noticing thought, acknowledging the thought, and then just gently bringing our attention back to the practice. The distractions is actually an integral part of the meditation. Because every time we detect that our awareness is away from the meditation and we bring it back, that's the push-up. That's the mental push-up. That's actually the thing that helps us to essentially change our brains, essentially upgrade the channels between the left and right brain so that our logic and our emotions actually go hand in hand. And that the distractions, are our thoughts, are our emotions, are our experiences with life. And all we're doing is to train our attention to direct at it and to direct away from it.
Okay, I think this will be the last question I ask because then we'll have to wrap up. But I live in Vancouver. There's a lot of people who do yoga. It's a thing. Can you achieve similar mindfulness benefits through the practice of yoga?
Yes. But once again, it depends on the cognitive fingerprint that the person has. Right. So not to get too deeply into the karmic religion's view on spirituality and spiritual achievement, but karmic religions have long talked about how for some people, their spiritual path is more logical, is more knowledge-based. For some people, their spiritual path is more on the meditation side of things. And for some people, they can achieve, quote unquote, enlightenment or, at least improve their mental health through physical activity alone. And that includes yoga, that includes working out, that includes, long distance running, what have you. And so the whole thing about meditation and mindfulness is that it's also denoted with a huge caveat that, your way of meditating forward may actually be an exercise instead of a meditation practice, instead of studying religious texts, etc.
Amazing. Okay, so time to conclude this webinar. I want to thank Yeung Liu for your insight and participation on the topic of mindfulness and guiding the relaxing meditation session. We want you to put wellness first with Circle. Integra Health and Thrive Health will show you how Circle can enable and empower your team's mindfulness, improve health and wellness, and create a thriving workplace community. To learn more about Circle, check out the website on the screen, and I think it's right there as well. Thank you once again for everyone's participation and time. Please take care.